Thank you, Pavitra. Um, so I'm going to be giving my next talk today. The practical need of the latest dry eye diagnostic tools and dry eye diagnostic and therapeutic tools. So we all know that there is a severe increase in the incidence of dry eye all over the world, and 35% of the world's population currently is suffering from dry eye. So, what are the metrics that normally is available in our clinics to evaluate dry eye? Being the Schirmer's test, the tear breakup time, checking the blink rate. You may do a fluorescein stain, a rose Bengal stain. You have the lissamine green staining, the OSDI questionnaire, and the Oxford grading. But none of these metrics can help us differentiate between what type of dry eye it exactly is. And hence, there is a need of a modern day diagnostic tool to detect dry eye. So, here is the different kinds of modern day diagnostic dry eye tools available in the market today. Um, so first, I would be just talking in brief about the IDRA ocular surface analyzer. So what are the different parameters that this tool can give you? Them being the NIBUT, the lipid layer thickness, meibography, and the tear meniscus height. Now, in the meibography, what it does is with the help of infrared technology, it photographs your meibomian glands and tells you what is the exact percentage of the area which is lost in both the upper and the lower lids. Coming to the non-invasive breakup time, it tells you it's the time elapsed from the last blink to the appearance of the first random break in the circle on the ocular surface. So a normal would be anywhere about 20 seconds. In mild dry eyes, it would drop down to between 10 to 20, and in severe, less than 10. Finally, coming to the lipid layer thickness, it uses interferometry and detects the colored lipids on the patient's eyes and hence determines the lipid layer thickness. A normal one would be anywhere between 60 to 100, and anything less than 60 is a deficient lipid layer thickness. Now, this is important because if the lipid layer is deficient, there are higher chances of the tears getting evaporated faster from the eye. So, the pathology, you can differentiate between an evaporative dry eye or if it's an aqueous dry eye. And the tear meniscus height is the measurement that can be taken non invasively. And here you take the measurement from the bottom lid up to where you can see the height of the tear. A normal would be zero point 0.1 to zero point 0.5. Now, in today's era, where people are having so much of unhealthy food, there is an increased screen time and increased use of air conditioners because people are cooped up in rooms and have desk job, the incidence of dry eye is definitely on the rise. And the current treatment of dry eye is definitely not good enough. People are giving blanket therapy just with drops, and that doesn't usually suffice for the patients. So, what are we know already that there is a role of warm compresses in MGD where people take a wet towel and place it over the eyelids. But there is one defect in this is that the heat is usually wicked away by the blood vessels, and therefore the amount of heat which actually reaches the meibomian glands is very limited. So then we decided it is better to have a multi-treatment approach, which involves a lid massage, lubricants and topical cyclosporins, oral treatment if there is deficiency of any vitamin D, and the modern day treatment modalities. Now, talking of the different modern day treatment modalities, you could either have thermal therapy or an intense regulated pulse light therapy. The thermal therapy works by application of both heat and pressure and helps in the expression of meibomian glands. The IRPL, or the intense regulated pulse light therapy, stimulates the zygomatic nerve, which increases the parasympathetic outflow to the meibomian glands and the lacrimal glands, leading to the actual expression of meibum. Now, in thermal therapy, there are different modalities available, being the LipiFlow, the iLux, and the TearCare. The LipiFlow is the most common one. It usually provides not only pressure over the lids, but also a heat of around about 38 to 42 degrees. And this combined technique helps with the expression of meibum. Now, I'll just show you a short demonstration. This is how the applicator, in case of the LipiFlow, is applied to the eye. If you see there is the heat provision is on the outer lid, and then there is a pressure also from inwards, therefore squeezing out the glands. So this is exactly how the LipiFlow would end up working. Now, this is the literature search where we see that how that LipiFlow treatment results in almost 9 months of sustained improvement in cases of dry eye. Similarly, we've seen that LipiFlow can be successfully used both prior to cataract and refractive surgery in patients of dry eye for the effective management of the same. Now coming to IRPL, we have multiple various modalities like the EI and the iLight freely available in the market. Like I said here, what happens is you apply jelly below the eye, and there is an application of a xenon flashlight at 5 different points, 4 below the lid and 1 on the side on the temporal aspect. What happens here is that it stimulates the parasympathetic branch of the zygomatic nerve is stimulated, which then goes and stimulates these glands, that is the meibomian glands and the lacrimal glands, to open up, and hence there is a secretion of meibum. Now, usually the EI comes with a treatment protocol that there is usually 3 definite sessions required at 0, 15 and 45 days, and the effect is usually seen by the end of the first or the second month. If the patient is not doing well even after that, there can be a 4th optional treatment which can be given on the day 75. So what exactly happens is, because the meibum is expressed, there is an increased lipid layer and there is a restoration of lipid layer in these patients. Again, a literature search showed us that IRPL has successfully been used for treatment of MGD in multiple cases, and there is also the use of it to treat evaporative dry eye, and the people who are undergoing even cataract and refractive surgery have had a favorable outcome by the use of the same. Multiple studies again proving the same, how the different parameters improve following a treatment with IRPL. So in today's time, a multicentric approach of using both your normal topical lubricants and cyclosporins along with a modern diagnostic dry eye therapeutics can help and go a long way in the treatment of dry eye. Thank you.
Thank you, Dr. Nikhil. Just one question I had. You said that for the LipiFlow, one treatment there was a study that said it would last for 9 months. Practically, does it last for 9 months?
Definitely in our practice, we've seen that the effect definitely lasts for around about 6 to 9 months in most cases. Unlike the IRPL, where you need repeated sessions, in that at least 2 to 3 sessions is what is required. In case of a LipiFlow, a single treatment is usually good enough. Although it is an expensive procedure as compared to an IRPL because of the personal interface and things of that sort. But yes, definitely clinically once given, it need not be repeated for at least of a period of 6